4 regional webinars hosted by the author team of the 5th National Climate Assessment, NCA5, with a special shout out to the North Carolina State Climate Office for providing us the kind of infrastructure on the through Zoom and scheduling, and Bobby and Kaylin doing such a great job putting this together and lining up our wonderful panel today. Where, as you can see, if you're just joining us, feel free to say hello in the chat, add where you're reporting from, who you work with, and introduce yourself. As we go throughout the presentation today, you'll hear some short remarks about the climate change and health related key message from the chapter. And then you'll hear from a illustrious panel of experts on climate change and health interactions in the Southeast. And throughout today's presentation, if you'd like to throw some questions as you think of them into the chat, we don't have a lot of time at the end of the program to be, answering all of the questions that we get. However, if we have some time at the end, we'd love to be able to answer your questions with the full panel. As a reminder, we're going to be having 2 more of these webinars for the remainder of our key messages. Key message 3 is all about the economics and the financial stability and vitality of our communities in the Southeast. And the 4th key message is all about agriculture. And so you'll see those 2 webinars. Next month is KM3 about economics, and our 4th and final webinar will be in May. Now, I also wanted to bring attention to, we are hosting the 5th National Climate Assessment Southeast Chapter's in-person practitioner and science workshop in Raleigh, North Carolina on April 3rd, 2024. So just a few weeks from now. And we're splitting the day into 2 sessions, one focused on science and what can we improve on for NCA 6, and the second half of the day spent on practitioners and putting into and operationalizing, putting into our work the findings of the 5th National Climate Assessment Southeast Chapter. So we'll throw the link to the sign up to that in the chat. If you can join us in Raleigh, that would be fantastic. But without further ado, I'd like to introduce my colleague, Claudia Brown, who's going to be leading a short presentation on our key message and then facilitating a conversation with our panelists. So Claudia Brown is a health scientist at the CDC, the Centers for Disease Control and Prevention's Climate and Health Program. They're the national leader in empowering communities to protect human health from a changing climate. And Claudia's work specifically focuses on understanding the human health effects of climate change, how communities are disproportionately impacted by climate impacts, climate adaptation strategies, and data and tool development to increase the capacity and prepare for and respond to the effects of climate change. Claudia serves as a member of the USGCRP's Climate Change and Human Health Working Group. She's a technical monitor to the Council for State and Territorial Epidemiologists, or CSTE, Climate, Health, and Equity Subcommittee, and she's a member of the National Tribal Resilience Data Work Group. And most relevant to today's conversation, she was critical as a co-author of the Southeast chapter of the 5th National Climate Assessment. So join me in welcoming Claudia Brown to deliver our remarks this morning. Thank you, Claudia.
Thanks, Jeremy. Thanks for the introduction. So I'm so happy to be here with you guys and discuss the health key message of the 5th National Climate Assessment Southeast Chapter and facilitate a discussion with some wonderful panelists that we have here today. If you can go ahead and go to the next slide. So as Jeremy mentioned, I'll be discussing key message number 2 of the Southeast chapter, which is how climate change worsens human health and widens health inequities. In this section of the chapter, we're really talking about how human health and climate stressors are intimately linked in the Southeast, how community characteristics such as racial and ethnic populations, chronic disease prevalence, age, and socioeconomic status can influence how climate change exacerbates or introduces new health issues, and how climate change is already impacting health in the region and effective strategies to address the health impacts of climate change in the Southeast that have multiple benefits across social and environmental contexts. Next slide. Public health status is super important indicator in predicting how a community will be affected and respond to the health impacts of climate change. And the Southeast is unique in that it's ranked among the unhealthiest region in the nation with a shorter life expectancy than the US average. And there's a lot of health disparity or differences in people with higher or lower life expectancies across the Southeast. And this is due to factors such as lack of access to health care, low socioeconomic status, and poor health behaviors, including smoking, drug and alcohol abuse, and a lifestyle with less physical activity. Sedentary lifestyles in the Southeast are reinforced by a lack of safe and feasible pedestrian and cycling infrastructure, with the Southeast being home to 8 of the 10 least walkable cities, 15 of the 20 most dangerous cities for pedestrians, and 4 of the 10 top deadliest states for cyclists in the US. Importantly, the Southeast is home to more Black residents than any other region in the US, which have unique challenges as Black communities in the Southeast shoulder a disproportionate level of risk to the health impacts of climate change. This is due in part to Black communities having even lower life expectancies and less access to resources that promote health, such as grocery stores, safe places to exercise, and quality health care, as well as socioeconomic opportunities with fewer employment options and limited access to quality education. So these present-day health inequities that exist in the Southeast exacerbate residents' risk to the health impacts of climate change. Next slide. Now I'll be getting into some of the specific health burdens caused by climate change in the Southeast, with the first being heat. Southeasterners are no strangers to heat, though climate change is increasing the frequency, duration, and intensity of heat waves, and the heat seasons are becoming longer. As a result, air conditioning demand is expected to grow, though not everyone has access to air conditioning or can afford air conditioning. So while the Southeast has some of the lowest energy rates in the US, we also have the highest energy bills, and this is because of high energy use and inefficient building infrastructure. And these high energy bills disproportionately impact rural and under-resourced residents, elderly residents that are on a fixed income, and communities of color. As demonstrated by the figure on the left in this slide, the dark purple areas show high overlaps between Black, Indigenous, and people of color households, also referred to as BIPOC, and high energy burden. And the figure on the right is showing where in the Southeast we will see the highest increase in the number of days above 95 degrees, demonstrating that these households already experiencing high energy burdens will be further stressed by the increase in temperatures. Cities are experiencing even warmer temperatures due to the urban heat island effect, which is where cities experience warmer temperatures than outlying rural areas due to having more developed land that holds in the heat and less tree coverage to shade. Heat island intensities across the Southeast are systematically higher in formerly redline communities and in counties with higher proportions of Black, Hispanic, and Asian residents. People with education no higher than a high school diploma, people with lower median incomes, and single-parent households. Next slide. Also affecting energy security is the increase in extreme weather events, which can cause blackouts. For several states in the Southeast, major blackout events occur more often during the warm season, which is we're defining as May to September. And major blackouts during the warm season generally occur during heat waves, placing people at higher risk of heat exposure and heat-related illness because they do not have access to air conditioning. The figure shows reported major blackout events in the Southeast from 2011 to 2021. The orange bars represent blackouts during the warm season, that May to September, time frame, and the blue bars represent the non-warm season, which is October through April. Louisiana has the highest number of blackouts during the warm season, and Virginia has the highest number overall. Climate change is increasing the risk of multiple dangerous weather events occurring simultaneously or around the same time, which is resulting in worsened health effects. An example of this is when a heat wave occurred in Louisiana as they were recovering from Hurricane Laura in 2020. And this resulted in at least 8 deaths due to heat and an increased risk of heat-related illness, particularly for those who lost electricity and outdoor workers assisting with the recovery. Next slide. So I'm going to transition now to talk a little bit about air quality. While the Clean Air Act has improved air quality in the Southeast, climate change is threatening those improvements by increasing smog and wildfire conditions. Particulate matter caused by pollution and extensive vegetation across the Southeast is already affecting respiratory health. Though, and this is particularly for communities of color and lower socioeconomic status. And the Southeast is expected to have the highest number of premature deaths due to increases in particulate matter caused by climate change. So future premature deaths due to PM 2.5, which is this particulate matter that we often refer to in the region, could be avoided through significant emission reductions, even when considering future warming. So as demonstrated in the slide, the map on the left is displaying current distribution of particulate matter in the Southeast, and the map on the right is demonstrating potential future premature deaths in people 65 and older due to particulate matter based on 2 degrees of global warming. So this is showing that even when accounting for reduced particular emissions in the future due to developments such as vehicle electrification, the Southeast is still particularly sensitive to increases in PM 2.5 just from temperature alone. In addition, seasonal pollen poses a significant health burden to people in the Southeast, aggravating respiratory conditions such as asthma. Due to climate change, pollen seasons are expected to worsen as winters shorten and the pollen season starts earlier and lasts longer. Already in Atlanta, for example, which is where I am, there has been an increase in tree pollen by 4% in the spring and 10% in the fall. And the weed pollen has seen an increase of 5% in the spring. Next slide. Also of concern are wildfires. So with warmer temperatures and less soil moisture due to drought, wildfire risk has increased. Wildfire risk disproportionately disrupts the lives of socioeconomically disadvantaged communities in the Southeast, as rural and mountainous portions of the Southeast are more exposed and less equipped for mitigating wildfires. And as more people inhabit forested areas, there's an increase in wildfire risk to human health and property. In 2016, for example, wildfires in western North Carolina and eastern Tennessee highlighted that connection between exceptional drought and fire in the Appalachians, as power outages and damage to PVC pipes, which supplied water to sprinkler systems, led to a lack of water to combat the fires, and this resulted in significant damages. That year, nearly 50% of wildfires in the entire US occurred in the Southeast. Yet these fires contributed to only 29% of total burned area. So this is just demonstrating that the Southeast, while it does have, there are wildfires that are prevalent, they tend to be smaller. Next slide. So I'm going to talk a little bit now about how climate-sensitive infectious diseases are impacting the Southeast. Temperature and precipitation changes are anticipated to shift the geographic distribution and season of certain disease-carrying mosquitoes and ticks in the Southeast. For ticks that carry diseases such as Lyme and Rocky Mountain spotted fever, models are projecting that varying shifts in ecosystem suitability depending on the species, that there are shifts depending on the species. Land use changes, and host abundance. So of particular concern are mosquito-borne diseases such as chikungunya, dengue, malaria, West Nile virus, and Zika virus. All of these diseases have been documented in the Southeast and pose potential risk to human health as their distribution is shifting due to climate change. Additionally, harmful algal blooms, which is referred to as HABs and also known as red tides or brown tides, these occur in both fresh and salt and brackish water and result from the overgrowth of algae. And this is due to both warmer waters and temperature, but also runoff from excess nutrients from agriculture and lawn maintenance and other land use development. HABs have significant negative impacts on human and animal health, as well as broad-reaching environmental and economic effects. Humans may experience various health issues from HAB exposure, such as diarrhea and headache. And HAB events also threaten national and local economies as tourist areas become less desirable to visit. Fisheries and aquaculture industries suffer from the loss of marine life and decreased species diversity as ecosystems are disrupted and hypoxic conditions occur. And then, of course, consumers of consumers of seafood, particularly, are potentially exposed to poisoning because of the HAB contamination. As an example, large masses of sargassum, which can fall under this HAB classification, have been increasing from Florida across the Caribbean since 2011, causing harm to coastal, social, and ecological systems. This problem could be intensified by rising temperatures from climate change as it's creating a more suitable environment for growing HABs and algae. Next slide. So the Southeast is home to 5 out of the 10 highest ranked states for the prevalence of mental illness, and 8 out of the 10 lowest ranked states for access to mental health care services. So in the Southeast at baseline, we have a mental health issue. And then climate change is significantly affecting mental health as a result of acute disaster events such as hurricanes, floods, and wildfires, long-term changes such as drought and heat stress, and existential threats of long-lasting climate change impacts that make people feel less secure in their physical environment. Those who are either directly impacted by or concerned about the threat of climate change to themselves or others may experience what we call eco-anxiety or climate anxiety, which is demonstrated by this image that is pulled from the health chapter of the National Climate Assessment. While extreme weather events commonly occur in the Southeast, climate change has increased their frequency and magnitude, causing residents to face repeated trauma and displacement at an unprecedented level. And this is leading to stress and the onset of new psychiatric disorders or the worsening of pre-existing mental health conditions, especially among children and those that are under-resourced in communities of color. Next slide. So a lot of doom and gloom covered in the last few slides, but I do want to mention and highlight that the Southeast is addressing these new and emerging health challenges in several ways. Miami, for example, has instituted a heat resilience officer to prepare and respond to extreme heat. The South Georgia and North Florida region is implementing prescribed burns to reduce the risk of large wildfires. The Florida Department of Health in Monroe County are ensuring more equitable access to shelter services, particularly for those with access and functional needs during emergencies through evaluation and operational adjustments. And in Chatham County, Georgia, a hotspot for West Nile virus, they're implementing risk communications to increase awareness of personal risk and protective measures against mosquitoes, with a focus on Black and under-resourced neighborhoods. These are just a few examples of some of the initiatives in the Southeast being implemented to address the health impacts of climate change, and we'll learn more about these initiatives during the panel discussion, which I'm now going to transition into. If you can go to the next slide. So with that, I'd like to take this time to just say thank you for this opportunity to discuss this important topic and key message. And I would now like to welcome our panelists who have joined us to talk about climate change and health in the Southeast and their specific work. So I don't know if, Kaylin, you want to transition into just, you can take my slide down, that's fine. Thanks. So joining us is first Dr. Jordan Clark. He is a senior policy associate at Duke Heat Innovation Policy Hub in the Water Policy Program at the Nicholas Institute for Energy, Environment, and Sustainability at Duke University. We have Ms. Ginger Clow, regional nurse consultant at the Breast and Cervical Cancer Control Program in the North Carolina Division of Public Health, Cancer Prevention and Control Branch. And we have Keishan Pearson, board president and co-founder of Memphis Community Against Pollution. So welcome, everyone. Glad you're here. I'm going to kick it off with a question or an opportunity for each of you to introduce yourselves and talk about how your work is promoting resilience to the health effects of climate change in the Southeast. And we can just go in the order that I introduced everyone. So Dr. Clark, if you want to kick us off.
Hi, yes. Hi, everyone. Glad to be here. As Claudia said, I am Jordan Clark, and I am from Duke at the Nicholas Institute for Environment, Energy, Environment, and Sustainability, and specifically working within a program called the Heat Policy Innovation Hub. So our ultimate goal is translating and taking established science, specifically about extreme heat, and turning that into practical, actionable policies that actually get implemented, and we see the real effects on the ground. And we kind of cover a lot of diverse ground there with looking at planning and preparedness specifically. We have did a report on the hazard mitigation plans that states do, which they're required to do in order to access certain disaster declaration fundings and climate mitigation funding. And we found that only 25 states had a section for extreme heat, and only 12 states had extreme heat mitigation strategies within that. So there was a very clear gap in practical solutions on the mitigation side, and ultimately how that then related to helping those more vulnerable to extreme heat. While a lot of vulnerable populations were identified and mapped, there was an overall tendency to generalize and not really hone in on specific effects and the specific geography of where people are and who's vulnerable and when, and especially within the context of climate change, understanding who is vulnerable, when they're vulnerable, and where they will be spatially is important for long-term mitigation projects to ultimately be successful. And I think the biggest thing that we are kind of focusing in on and doing here is, like, historically and rightfully so in many contexts, there's a lot of emphasis on heat wave events and describing heat wave events and trying to define what is a heat wave. However, in the Southeast, I feel like we're all in the Southeast, it's always hot and humid. But I say that, and that's when it's dangerous. This chronic heat, this everyday exposure is ultimately increasing overall, one, but it's already dangerous. So it's this everyday chronic exposure coupled with occupational exposure, other things like pregnant persons or the unhoused, these layers and cascading effects within this everyday exposure is really what we're trying to get at here. I think that's kind of the biggest thing in trying to get and encourage plans to kind of incorporate notions around chronic heat and managing that and messaging about that and kind of tackling that. And then parallel to that, the last thing I'll add here real briefly is we are trying to bolster communications and deriving strategies around the extreme heat impacts for actually rural populations. A big lack in current hazard mitigation plans and overall is looking at actual health data. It usually only includes climate data. And climate data is obviously important, but the health data, understanding when people are actually impacted, is arguably more important. But there are a lot of challenges there with the restrictions and privacy and cost, so that there's just a lot of barriers to jump through there. But when you actually do look at those health outcomes, you see that rates of heat-related illness are much higher, 5-fold higher in rural areas. And there's a big gap there in the strategies to implement in those areas, since strategies developed for urban areas like cooling centers are not directly transferable. So there's quite a lot there, but yeah.
That's great. Yeah, thanks for that overview, Dr. Clark, and I will now pass it off to Ms. Clow.
Hello, everybody, and good morning. I want to thank the committee for having me here and for everybody taking time to come. I'm a lifetime resident of North Carolina and have lived in every part of the state in northeastern North Carolina growing up, lived in the central part of the state for about 18 more years, and now I'm a resident in Western North Carolina. I'm a career public health nurse, and currently my work I work with the North Carolina Cancer Control Branch in the breast and cervical cancer program and Wise Woman programs. We do not have specific policies or protocols or really recommendations for local health providers regarding heat and cancer control or chronic illness prevention and mitigation. We do have in May during one of our regularly scheduled retreats, a meeting. I'll be leading a meeting about the impact of climate change and cancer prevention, cancer control, treatment, early detection, in hopes that we're able to push this information out to the North Carolina Advisory Committee for Cancer Coordination and Care. I also am a fellow with the Alliance of Nurses for Healthy Environments, and through that work, I'm working with local community-based organizations in Asheville, Greenworks, helping map out a heat study they've done in Buncombe County, my home county, and developing a dashboard and toolkits around understanding the heat impact at a micro level in our community. I work with UNITE, another community-based organization for developing education for community health workers to provide further information for people, specifically around heat and humidity and health risk related to that. And finally, I'm part of a group that works with Medicine Wheel Way with Buncombe County, Public Health, Counterflow, and Emoja, another community health organization, to provide nature-based restorative mental health practices for youth. So I'm glad to be here. It's a broad conversation, and I hope to be able to learn and contribute today. Thank you.
Thanks so much. So now, Mr. Pearson, over to you.
Hey, everybody. Good morning. Good morning. I want to say thank you for my family, my girlfriend for joining. My parents are here. My mom, dad, my brothers, Tim, Justin, State Representative Justin J. Pearson, and my brother, Tim. They were able to make it. So first, I love and appreciate y'all. Thank y'all for joining. My girlfriend, Rachel, is in Miami right now. So thank you for joining us, as well as Kimberly Davis, who is a part of Memphis Community Against Pollution, which is who my family and I represent. And Memphis Community Against Pollution started out as Memphis Community Against the Pipeline. We were fighting a billion-dollar conglomerate here in Memphis, Tennessee. And that work, excuse me, continues to transcend into protecting our environment and protecting the folks of Southwest Memphis who are most impacted by climate change. I did also want to thank North Carolina State for the platform, Southern Environmental Law Center for the invite, Southeast Climate Adaptation Science Center, the Southeast Sustainability Directors Network, Groundwork USA, Carolinas Collaborative on Climate, Health and Equity, and all the agencies involved in the development of the 5th National Climate Assessment. And so what MCAP does, we do 3 things. We educate our community as well as the metro area on environmental injustice that is taking place. We have 17 toxic release facilities here in Southwest Memphis that contribute to the cancer rate. We also work alongside amazing organizations like the Southern Environmental Law Center to gather research that helps inform our decision making and inform our community as well. And we advocate for legislation. So whether it is city and local or state level or federally with the direction of the Environmental Protection Agency. We work in order that we change permits, we change laws, and make our communities safer.
Thanks so much. So I actually, while you have the mic, might go ahead and start with you, Mr. Pearson, about the work that you guys are doing. So the Southeast chapter, as I talked about this to open up, really acknowledges how frontline communities, and I didn't use that term, but when we talk about frontline communities, we're usually talking about those hit first and worst by climate change. And in the Southeast, that tends to be, these, I referred to this in my presentation, but BIPOC populations, people that are already experiencing health disparities that climate change will exacerbate. So could you maybe speak a little bit to what you wish people knew about the challenges and work going on in these frontline communities?
Thank you so much, Claudia. So there are a lot of challenges that are presented in the national assessment, and there are, excuse me, there are a couple of things that everyone should know. That Black people are 30% more likely to live in places with higher rates of child asthma, higher rates of deaths that are correlated and related to extreme weather conditions. And so part of what has happened and part of what's important about understanding what we are experiencing and have experienced is that we face a cumulative legacy burden. This hasn't happened in a vacuum, and this isn't episodic or something that has transpired quickly. This has happened and been approved over the course of at least half a century. A lot of uh, gentrification, a lot of redlining has forced folks into places where there are toxic release facilities, where there are less and relaxed rules and regulations around permitting that allow these billion-dollar corporations to really do whatever it is they need or want to do in order to produce a product at the sacrifice of folks' lives. And the sacrifice of life is something that's personal to me. I lost, excuse me, my grandmother Gwen, which is my mom's mom. She was a nurse, cared for thousands and thousands of people. And my father's mother, my grandmother Pearson, who drove a school bus thousands of miles for thousands and thousands of children for decades. And they both were stolen from us by cancer. The toxins in our area, like ethylene oxide, um, a lot of pollution from our Valero refinery that is right around the corner, coal ash that have been burned for years and years, the coal ash that's now being trafficked through our communities, cause us to lose folks and suffer long before our family members have transitioned because of how it upends families economically and structurally. In frontline communities, though, I do want to just make sure that we don't just talk about what the negative outcomes are. A lot of focus is there. In frontline communities or communities where folks have decided using legislation that it's okay for these people to die, to experience such dangerous chemicals, to have it upend and change and destroy lives and families. We're just not the place where the casualties of policy murder exist. We also are where the solutions for those issues are geniusly developed. As you see, Memphis Community Against Pollution started as a group of people who were concerned about a specific event, and now the work that we do transcends not just our area, but across the entire state. And so we do face strangulation by coal ash pollution, toxic carcinogens like ethylene oxide, coupled with a poverty rate that's near the worst in the country. And you spoke to some of that and how it's correlated. And we also have institutions that continue to debase and try to marginalize our communities. And so when we think about what frontline communities are facing, it's multifaceted. We also have a state house where politicians preempt our calls for protection from polluters. And we have a health department, unfortunately, that says our cancer is from our diet, right? Just making us, the people who live here, work here, making us the scapegoats. And so the last thing I'll say about what we face and what the major issues of that frontline communities, communities that you could say are placed in sacrifice zones, one of the most dangerous things is racism, right? A lot of this exists because of racism. Racism is a danger to everyone who lives in a frontline community. Environmental racism is what has got us in this place. It's created the environment for this to happen. And racism continues to devise ways to increase this harm as our environment becomes more volatile. As you mentioned, the infrastructure and the plans that we don't have, Dr. Clark, will only continue to exacerbate negative outcomes, death, and destruction, right? And so the challenges that we face are nuanced, and they are many. But I do believe, and I've seen what people power can do. I've seen what a group of folks who are focused and have a goal can accomplish that is multi-generational, a coalition that is multi-generational and multifaceted. People from all classes working together, much like the people in the Zoom room, how that can change and transform the very existence that we live in. And so the trajectory of where we can go is a positive one, but it's going to take an extreme amount of intention.
Thank you so much. I think you, really highlighted and brought down to the community experience level, what we're communicating in this national climate assessment. So, it's great to have you here and to talk about the great work that you guys are doing and how you're addressing this. I'm going to turn it now to Ms. Clow. I know you are involved in various aspects of the health impacts of climate change in North Carolina. So I'm curious, can you speak a little bit about some of the projects that the North Carolina Division of Public Health is working on and what excites you in regards to the work that you're doing on to increase kind of climate resilience?
Yes, first, I just want to say thank you, Mr. Pearson. That was just the class we all need to show up for and hear about, and to hear the life-affirming jewel in the middle of all that's very hard. And I know that we all know that mental health is one of the crises in our nation, in our communities, and specifically related to mental health. I want to give a shout out to one of my colleagues in the Division of Public Health, Joe Bowman. He is the emergency preparedness nurse consultant in the Office of the Chief Public Health Nurse in North Carolina. And Joe, he's also a former fellow with the Alliance of Nurses for Healthy Environments. And Joe has created a series of modules for local public health departments that will elevate the content knowledge for local health department staff about climate change and health. And he's also will be presenting at a conference for about the community health assessment work in North Carolina. So I did work at the Buncombe County Health Department previously, and we were one of the first counties to include climate change and health in our community health assessment. So I think these are inroads that I'm excited about, because while there's a ton of research, the working knowledge for healthcare providers, community-based organizations, and faith-based leadership in our state and across the region, the connections aren't made in a intersectionality of all the disparities in health and life course outcomes and climate change. And both you, Dr. Brown, and Mr. Pearson have spoken to, and Dr. Clark, those intersectionalities. So I don't want to repeat that, but I want to elevate the work that's being done to address those intersectionalities, including climate impact, for making every condition and every life outcome that we can name worsen. I also want to mention that in North Carolina, in the Division of Public Health, in the epidemiology section, we do have a climate and health program, and they are focused primarily on wildfire risk, smoke from wildfires, and heat, including direct public health education, heat alert systems, surveillance. So there are initiatives happening at the statewide level, and initiatives that I think at the local level. And I think it's the combination of region, state, and local that becomes important in creating collective impact in our work about climate and health. And if I can add one thing, the work with Medicine Wheel Way, Unite, Emoja, Counterflow, and Buncombe County Public Health, it was a program set up specifically with youth, BIPOC youth in Asheville and Buncombe County to find out what they want, what they need, and develop nature-based restorative practices for them to have, with elders bringing in those practices and support. And it was so successful that we have the youth saying, do this more, do it more frequently. And we have significant people who can help with the funding joining in with that. And this is where we have to be bold and we have to try something different and new. You know, look, where is the evidence-based practices, but what is new and especially what are our youth, what are our elders calling for? What do our families and communities need? And the solution is with the people. And we have to make a place at the table and share power so that the solutions can come forward. We will not create them from organizations, government sponsored only. We're leaving out our communities, and it's imperative that our community voices and leaderships are front and foremost, and utilizing place-based knowledge in adapting and creating adaptations to climate change, health risk, and our communities. People love where they live, and they want happy, healthy communities and families. They want to thrive where they are. They don't want to be pushed to relocation to survive. And so helping communities identify and achieve those adaptation and mitigation practices at a local level is very important. So I want to name that, even though we're talking about a region and statewide initiatives. Thank you.
Thanks so much, Ginger. I think, yeah, that really resonates. And I like that this discussion is moving towards, gaps and things that we can do to, enhance resilience across the Southeast to the unique challenges that are being faced here. So I'm going to now turn it over to Dr. Clark. Can you talk a little bit about the gaps in heat policies that the Heat Policy Innovation Hub are seeking to fill? And have you seen any of the proposed actions put into effect? What are you seeing as being some of the most impactful solutions around that?
So building off what Ginger actually just mentioned is we have been taking part in a statewide initiative with various departments, North Carolina Department of Health and Human Services, and also the North Carolina State Climate Office to create a template for counties to be able to create a heat action plan specific to their community. So last summer we did a pilot program with 10 communities and had emergency preparedness officials and public health officials all gathered in a room, walking through this template of like what's supposed to happen when this is supposed to happen, how do we educate, how do we disseminate materials to different people in the population, and how do we kind of just deal with the very diverse landscape that is the challenges of extreme heat ultimately. And this is very niche, and it hopefully will be able to serve as a model for other states, because nested within this template is not only the specific actions that a given local government should take, that specific office should take at a certain time, but it's also paired with a very robust heat warning system that is linked with health outcomes. So using emergency department visits, regionalized thresholds across the state to account for the variability, since those in the mountains are going to be more vulnerable at a lower temperature relative to those at the coast. So this really robust heat warning system based on health outcomes, as I mentioned earlier, it's important to link those since health outcomes usually happen actually far lower than typical heat warnings are issued, especially for those most vulnerable and those that are working outside and don't have adequate cooling at home, occupational exposure. There's so many just layers, these cascading effects that just pile on and ultimately making that everyday exposure tremendously hazardous. And so that's really a big initiative we've been working on. But nested within that also is, I think we've touched on it some, is just kind of getting information out, and that is challenging. We actually have experimented. We made magnets for refrigerators that give like symptoms of heat stress and heat stroke, which were a big hit. And we also made church fans, like you see them at weddings or in church, like, and it has like instructions and like helpful information on it. And those have been like popular with partners about like giving those out because they're useful and there and providing that information. And then kind of parallel to all of that, while we have like a lot of different work going on, there's also this work surrounding taking that warning system and this idea of a warning system and trying to further figure out, okay, we can't warn everyone at the same time and people are vulnerable at different levels. So creating these very individualized ways of being like, okay, pregnant persons are vulnerable, they unhoused, these people in this area are vulnerable. And then not only just sending a text alert or some other kind of alert, but having trusted community leaders such as faith-based organizations, which we mentioned earlier, acting as a trusted source and a trusted conveyor of that information. So ultimately kind of taking the statewide initiative, the county level, local level, and then getting down to these very, very community-based options that then take all that information and put it into use. Because without that part, it's useless. It sounds good on paper and it checks boxes that are within hazard mitigation plans that it was created, but it doesn't have any utility until it's actually implemented on the ground with the community. So that's where we are trying to really kind of help in those efforts, and also trying to bring in some aspects related to providing support for energy costs during high heat periods, working with some energy providers, and kind of bringing in elements of the finance industry to really try to revolutionize how we view hazards broadly, but specifically how we like traverse this landscape of extreme heat, because it's not just the hazards from flooding don't translate to the hazards of heat, hazard specific vulnerabilities that are really one of the challenges with heat, I believe.
Thanks. I think those are some great actionable things that can be done. So I actually want to pose a question to everyone. So as Dr. Pearson was talking about the great work that his organization is doing in showing how grassroots movements can create healthier communities. It shouldn't be, of course, on the shoulders of these grassroots organizations to do this work, to be the catalyst for change. So what are some things that you all think can be done better by the public and private sectors, the scientific community, and even fellow community members to support those that will be disproportionately impacted by climate change? And I'll start with Mr. Pearson. And I think that the work that you guys are doing is so integral, but of course, you need the support of others and the various entities that are at work in the community. So I'll pass it off to you to start off with that question.
Thank you, Claudia. I'm not Dr. Pearson yet, but that might be in the future. My mom, she is finishing her dissertation, so she will be the first doctor in the family. She'll be Dr. Kimberly Owens Pearson. So, hey, Mom, congratulations! And so maybe I follow her footsteps. So thank you, Claudia, for the inspiration. And so to answer that question about what can be done and what so many different organizations and governments can do to help is a question that we also have to recognize, excuse me, we also have to recognize that these same organizations are those that have done the work and done the harm in our environment, and that work didn't, like I mentioned before, it didn't just happen, right? We are seeing a lot of the effects, but this is an erosion that has been taking place decade after decade, law after law that has been passed. But the main thing that is very troubling and the catalyst for all of these negative events, negative outcomes, and really a negative environment in the Southeast, especially, is a perception issue. And I'm going to reference Ava DuVernay's movie and the book by Isabel Wilkerson, and just saying that there is a dissolving of a perception and a trust in a caste system. And that says that there is a permanent subclass that is less deserving of humane treatment. And so the work of ridding ourselves of that oppressive ideology is going to be the first step for any institution or any organization, any community, if we are to move justice forward in any substantial way, and even begin the work of supporting frontline communities. And so that internal work has to be first. And then we must work to fortify our most vulnerable communities, like the one I live in 3A109, because they will be the most adversely impacted, right? And these adversely impacted communities are those that contribute the least to climate change. And so we need documenting of emissions. That's one thing that MCAP is pursuing, stronger permitting laws, updating requirements for land use permits, because these are the levers of the apparatus that allows this injustice to persist. There are permitting laws, there are land use control laws and permits that if companies are technically abiding, then our governments do nothing. And so making those changes. And so one of the other things that was mentioned is the energy burden. And I think you articulated that perfectly. Memphis has one of the highest in the country, which means that people are having to make a decision between air conditioning and groceries. And so our infrastructure is not prepared for the impacts of climate change. And poor and low wealth folks on the front line are paying honestly with our lives. Because of where I live, my life expectancy is lower. I'm expected to live 10 years less than my counterparts who are 2 miles away from me. And that's a disparate impact. And so if corporations, if governments, if these folks are going to help, they have to also help us create cheaper, cleaner power. That's the only way that we'll be able to create a sustainable change, not something that's just for the moment, not something that just sounds good on TV, not something that is greenwashed. For sustainable change, we need to generate cheaper and cleaner power. Every institution, including the scientific community, they have to prioritize supporting community-led organizations. And I think that was what Ms. Claw was alluding to, is that we have the solutions. We are here. We're in the moment. We know what is necessary. Don't discount the genius that exists in these communities just because of how we've been redlined, how we've been labeled, and this demonizing perception, right? And so include community-led organizations, include community in your decision-making process, but also invite them into the spaces where they are absent, into the conferences, into the boardrooms, and not only bring them in, but make sure that they feel comfortable, make sure that they feel safe, make sure they feel welcome. And so it's multifaceted. It's a lot of work, but it's the work that has to be done if actual real change is going to happen. If it's not radical change, it's not going to really happen. And so that's my perception, and that's the way that these organizations can and should help.
Thank you. Some really important points there. Ms. Clow, I'll pass it off to you because I think Mr. Pearson touched on some of the points that you brought up, around community engagement and how critical that is. Is there anything else that you'd like to add and to kind of get back to my question around, some actions that can be taken that will increase resilience in the Southeast?
Yeah, thank you. I think thinking through systematically, like the collective impact that we can have by not adding climate and tacking it on the way maybe we often tack on equity, but integrating it in climate in all policies, climate impact in all policies, and finding and articulating that intersectionality of what does chronic illness have to do? Why does climate change impact people taking cardiovascular or heart medicine or their diabetes medication? Or why do people taking certain medicines for their mental health conditions have higher risk of heat-related illnesses or deaths? What do overdoses, fentanyl overdoses, and alcohol overdoses in our community have to do with climate change? And I also think the other lift is articulating that in a way that is readily understandable and actionable for policymakers and decision makers in our community. So getting people to those meetings, having people sit on boards and making decisions, but also helping people make those connections so that we can shift through all the competition of need. There is multiple crises facing folks, and never before have we known so much about climate and climate change. And for many people, they're paralyzed by the lift that's required. So acknowledging the damage that's been done, acknowledging the unknowns for our future, and addressing the mental health needs so we're not stuck in the term now is eco-paralysis, where it's so overwhelming, the hopelessness and powerlessness and fear keep us from taking actions that we can take at the individual, local, state, and regional, national, global levels. And this is not just community members, it's everybody. It's our researchers doing climate research. It's our policymakers, our commissioners, our state legislatures who may just decide it's too much and not help. And so we have to find ways to acknowledge what is happening and get the message out and make the links to other issues that are critical, that have immediate needs right now in our healthcare. But we also have to help embolden our leaders to take action that can help people move forward. And I think life-affirming hope and embedded climate health in all policies is one approach.
Thanks so much. I would love to keep going and have this conversation for longer. It's been so great to hear everyone's voices and perspectives on this, but we do have to cut it off at some point. So Jeremy, should I pass it back to you to close us out?
Yeah, thank you so much, Claudia, and thank you everyone for sticking with us. I think I'm going to try and remove the spotlights here, but in either case, we appreciate everyone spending a little bit of time with us this morning, and again, thank you to all of our panelists. Thank you again to the folks at the North Carolina State Climate Office and NCSU for providing the infrastructure for this. And please, everyone that's join me in thanking our panelists.